Oké, we gaan deze webinar opnemen. En vandaag gaan jullie horen van dokter Andrea Etkie. Sinds afgelopen zaterdag is zij officieel verheven in de titel tot dokter. En is zij dus officieel gepromoveerd. Ze heeft me net wat foto's laten zien van de feestelijke gebeurtenissen. Dus ze is nu officieel dokter, is gepromoveerd in de VS en mag haar inzichten met ons delen. Dus ik denk dat dat een hele mooie aanvulling is voor de kennis en de inzichten die we al hebben in Nederland, om ook van haar direct te horen wat zij heeft gevonden. Dus ik ga jullie overgeven aan Andrea. Ze verwacht ongeveer een uurtje bezig te zijn. Als ze iets eerder klaar is, kunnen we aan het eind nog wat vragen stellen. Als je tussendoor vragen hebt, zet ze gerust in de chat. En als je deze opname terugkijkt, kun je ze ook nog eventjes mailen naar gerna.scholte@rett.nl. Dan heeft mijn voornaam wel een N en mijn achternaam geen N. En dan komt het op het goede adres aan. Dan kan ik je dan ook nog even wat antwoorden geven als die er zijn. Tenminste, als je vragen hebt, dan zal ik ze beantwoorden. Goed. Andrea, the floor is yours. I've just introduced you as Dr. Andrea, since you've been promoted this last weekend and celebrated with your family and friends. So yeah, we are very excited to learn from you today. Thank you.
Thank you so much, Herna. I am not able to see the chat or you all if you raise your hands just the way my screen is set up, so feel free to interrupt or I'll leave it to Herna to do so if there's something that you want to say in the middle. So thank you for introducing me. I am a speech language pathologist who for the past 10 years has been working with people with Rett syndrome in various capacities. And so this research is an outgrowth of my clinical work when I worked with students who were doing things like reading and writing emails, sending them to their pen pals. They were reading and writing at grade level or very close to. So basically, they were doing skills that were not reported in the literature, but really stood in direct opposition to what I was being told students with Rett syndrome could do. So I'm now a graduate from the University of North Carolina at Chapel Hill, and I worked under the mentorship of Karen Erickson at the Center for Literacy and Disability Studies. So you'll see that here. And if you want to know more about that or connect with her research, there's a slide at the end. So I will do a very brief introduction to Rett syndrome because I know many of you are already familiar with the disorder. It is neurodevelopmental and caused by a single gene mutation on the MECP2 gene of the X chromosome, which is why we see it often occurring in females and less frequently in males, although it does occur in males. And I think the last time I heard we had 60 diagnosed males in the US, and so that number is rising. It's rare. It's 1 in 10,000 female births is the incidence rate. And it's marked by this period of typical development. So parents think they're taking home a typically developing baby, and then there is this regression period of language and motor skills that's somewhere between the first year and as late as the 4th year. And this regression causes significant challenges in verbal communication and motor skills, as you all know. And so when we look at the research around what is said about communication profiles of people with Rett syndrome, we see these discrepancies between experimental research reports and then research reports from parents and professionals like yourselves that work with people with Rett syndrome. A lot of the experimental research says they are pre-intentional at communicating, that they don't have the cognitive skills to even learn to communicate, that communication and motor challenges just make measuring cognition really challenging. And so there's this assumption that their communication skills are pre-intentional and pre-symbolic. But what parents and professionals who work with them are constantly saying is that their children with Rett syndrome are not well understood by others and that their abilities are often underestimated. Some parents report that their children use symbolic communication and a full range of expressive communication skills like making choices, requesting, commenting, providing information about a topic. And so what we really see is that they use both aided and unaided AAC in very intentional ways. And uh, to do things like use eye pointing, body movements, facial expressions, vocalization, and of course, symbolic language to communicate their thoughts and ideas. So because Rett syndrome is a syndrome, it means there are many systems within the body that are affected. This figure is pulled from the communication guidelines, which I'm sure many of you are familiar with, but it just really highlights how many different impairments in one body can make communication very challenging. And then we have to recognize that there are external factors that make communication challenging too. So it's not just the internal factors that a person with Rett syndrome has to deal with, like on the graphic in the previous slide, but there are these external factors like the environment, right? So does the person have a supportive communication partner? Where does that communication partner get to interact with them? Is it just in certain settings? How often? Who was the communication partner? How many of them are there? What is their knowledge around AAC and being a supportive communication partner? Do they have the education needed to promote communication, reading, and writing? A consistent theme from parents and professionals who work with people with Rett syndrome is that oftentimes service providers lack the resources needed to effectively teach them these skills. So that's another factor that makes communication development that can impact communication development. The second thing I would point you to is the opportunities to learn. We know very little about the exact opportunities to learn to use symbolic communication, to learn to read and to write for people with Rett syndrome, but we suspect that they are pretty low. There was a study by Lariba Quest and colleagues of 40 parents surveyed with children with Rett syndrome, and most of them this was in the US, were being educated in self-contained classrooms. And we know that that setting typically has fewer opportunities to learn than an inclusive educational setting. And then the last external factor would be technological advancements. It's wonderful that people with Rett syndrome are known to use their eyes often to communicate, like sustained eye contact or eye pointing. And so eye tracking has been a positive factor that can help with their communication development. And so one more point that I want to bring to you about how the research talks about people with Rett syndrome's communication abilities. So these two terms are from a paper from 2023 by the author, I believe her first name is Lauren, but Doak is her last name. And so Doak offers these two terms that I find very helpful when we're describing the communication abilities of people like those with Rett syndrome. So this idea of being a systematic communicator, these are people who use a formal communication system like us, like speech or like sign language or AAC, well enough to express their views to an unfamiliar communication partner. So these are systematic communicators. And then on the other hand, we have idiosyncratic communicators. So this is someone who doesn't have or a very limited use of a formal communication system, but instead they use very unique ways that are really only understood, by familiar communication partners. And this is typically how we see people with Rett syndrome be described as idiosyncratic. But in fact, being a systematic communicator is one of the inclusion criteria for my study that I'm going to tell you about today. So the participant had to be considered a person who can use symbolic communication for multiple purposes and with more than one communication partner. So hold these two terms in your mind because we are going to come back to them in the findings. And then lastly, when we talk about literacy, we have to just acknowledge that the literacy skills of people with Rett syndrome is really under-researched and under-recognized. We suspect very low literacy rates across the population, but some parents are reporting that their children know some of their letters, have phonological awareness skills, and are reading at the single word level at least. And then we have one single case study of a child who did some unconventional literacy engagement. That was a little girl who was like interacting with books by putting them in her mouth and kissing them. And then there's also one more study from Erickson or Scott Coe and colleagues in 2004 with shared reading interactions between moms and daughters with Rett syndrome that had some really nice outcomes. So all of this background brings me to the current study, and that is this study was for my dissertation, and I asked this question. What do the self-reported preferences for expressive communication, reading and writing, reveal about the self-perceptions of people with Rett syndrome regarding their communication and literacy abilities? So I was really interested in asking them. So nobody's ever asked the people with Rett syndrome, like, how do you see yourself? And how do you see yourself as a communicator, reader, and writer? And so that's what I did. It was a multiple case study. I had 3 participants. I made multiple visits to the participants' homes, and I collected data in the form of videotaped interviews, transcribed interactions, field notes, and I collected case histories from each participant. On the first visit to each home, I spent time establishing a rapport with the participant. I collected a case history from the participant's parent, and sometimes that participant took part in that too. We completed the communication matrix together so that I would have an idea of their expressive language skills across 4 different domains, and then with varying levels of complexity. And then I came back 2 or 3 more times, and we did these talking mats interviews, and I'll show you what a talking mat is, although I know Heron has been doing some really cool stuff with them. And then we did some direct observations. And then the final visit, I did a formal member checking. And member checking is when you bring your research back to your participants and you say, this is what I got. This is what I saw. What do you think? And you kind of ask for input, and you're looking for, did I get this right? Did I totally miss the mark? And then I did a little bit more observations. Okay, so I mentioned the talking mats. This is a framework for interviewing. It's a low-tech tool that was developed to help people who understand the questions that are being presented to them, give them a way to express their thoughts or feelings, and then in a way allows for going back and changing their responses if needed, contextualizing the topic, allowing for further discussion. And so just to orient you to the mat, this is the top scale of the talking mat. It almost always is a 3-point top scale, and it can be changed out depending on what type of interview you're giving. I had the words good, okay, and not for me at the top, because I was asking about their preferences. In the middle are the options. So these are things that I was asking them each about, and then the bottom is the topic of the interview. Okay. Well, it looks like there's a lot going on in the chat, so I'm just double checking to see if
Yes,
okay.
that's me. I've been translating some of your sentences and trying to give like a little quick summary of some of what you've said in Dutch so that people can read if that, hopefully that helps if people need it.
Should we put on captions with translation? Do you think that would be helpful?
Does that exist automatically?
La la la. I thought so. Let's see. Show captions in Dutch. Hello. Do you see anything? I don't see anything yet on the screen.
Okay.
Hello.
Not sure.
Not sure.
I'm
Well,
not sure if that works.
okay.
Let's just continue, and I'll yeah, I'll write. And also when there are questions in the chat, I will report to you. Yeah.
Awesome. Okay. So as I said, I have 3 participants. They were all white, non-Hispanic females. They ranged in ages from 9 to almost 14. They all used the same device, which was a Tobii Dynavox i13. Two of them used the TD Snap language program, and one of them used Grid. They all used eye gaze to access their devices, and they all started using their device around like 3 or 3.5 years old. So what I did was I completed the Talking Mats interviews and videotaped all of them. I prepared the videos in Elan, which is a software that you can use to segment videos or audios to help with some coding. And then I took all of the videos, the transcripts, the field work, and everything, and I coded them, and I explored some themes that existed across the cases and then within each case. And I used a framework and a thematic analysis to look at all of the data. Okay, so before I get to the findings, I just don't want it to be lost that one of the most important, significant outcomes, in my opinion, of this work is that 3 people with Rett syndrome were interviewed regarding their thoughts. And so, to my best knowledge, this has never been done before. No one has ever asked them, how do you see that yourself? Most of the time, it is parents and professionals reporting on how they see them. Okay, so I would say that's one of the most significant outcomes. However, when I looked deeper at the results of the interviews, I came up with this infographic or schematic to kind of help organize the things that I found. So these are themes that occurred across the 3 participants. These are themes that occurred within the participants, and it all pointed me to this overarching theme of resilience. So first, the 3 participants all presented themselves to be adaptable, multimodal communicators. They all had different or incongruent views of how they perceived their own literacy abilities from the parents or adults around them. Rosie showed herself to be a risk taker. Cam was very dynamic in her learning, and Maven was very autonomous in the way that she described herself, all pointing to them each being resilient. All right, so let's look at the first theme first. So all 3 of the participants, Rosie, Cam, and Maven, were all aware that they flexibly used various modes of communication. So they rated modes of communication that worked best and worst for them. And I will show you what that looks like in a second. I also learned from all of these interviews that the 3 participants adapted their communication modes based on the communication partners. So you'll see this when we look at Rosie in a minute, but she adapted to using her body to respond to me in different ways than how she talked to her mom. And similarly, Maven, she told me this by listing people that she interacts with and then the ways in which she prefers to interact or communicate with them. So, for example, she has older sisters that are out of the house and grown, and she has a younger sister that lives at home with her. And when she told me about talking with her older sister, she said that she prefers that they read her body language and they kind of watch for her eyes over using her Tobii. And so that was really interesting, compared to her younger sister, who I saw walk over to Maven and sit near her and wait for Maven to use her Tobii. And even with Cam, the youngest participant in this study, she used different modes with me compared to the ones she used with her mom, which makes sense, right? Her mom is the closest person to her. She's her communication partner. And so Cam used a lot of vocalizations and her to get her mom's attention, and her mom interpreted these immediately, that she knew when she makes that sound, it means she's in pain. Versus with me, Cam didn't make those sounds. I don't perceive those sounds to have meaning at the time, and she had to tell me in other ways that she needed a break because she was not feeling well, and she did so using symbolic language. Okay, and then lastly, under this theme, their ratings suggested that they might prefer embodied communication over AAC. And so this was really interesting. So Maven and Cam didn't rate using aided AAC as highly preferred. So that means aided AAC as the things besides their body that help communicate their understanding, like using their eye gaze device, or using paper symbols, or typing on a keyboard. Rosie did communicate that she highly preferred using her aided AAC, but she used embodied communication way more than any other forms across the 3 interviews. And I think this just occurred because using embodied communication allowed each of the participants to adapt to adversity. When they were not being understood, they were able to quickly shift into a mode that was recognizable and clear, as opposed to trying to organize themselves into accessing their devices. So embodied AAC meant things like, I prefer when you watch where my eyes point to. I prefer when you read my body language. I prefer when my mom understands that that vocalization meant pain, things like that. And so the second theme that came out of this research was that Rosie, Cam, and Maven all viewed themselves differently from the ways that adults around them viewed their reading and writing skills. So this is an example of one of the talking mats that I did with, I think this was Rosie's, on asking her how she saw herself as a writer. So through the initial interviews and case history collections, I learned that all the mothers of the participants believed that their daughters were proficient readers and making steady progress with their writing. This is a quote from Maven's mom, and she said, her reading pace is pretty good. I don't know what it is, but it's not far behind mine. And so that was really interesting, because the quote that's at the very beginning of this talk, that is the title, is, I still have trouble with this. That is from Maven, from that daughter. So Maven is saying, hold on, I still need help with learning how to read. I'm not where you think I am. And her mom is saying, oh yeah, she reads like almost like I do, like an adult. So there was this incongruence between how they saw themselves. The second quote is from Rosie's mom. Rosie's mom told me she can read and write short sentences. And honestly, over the time that I spent with Rosie, I didn't see any indication that she could read or write short sentences. Now, it didn't matter totally what I was seeing. I was really interested on how the participants described themselves, but in looking at how Rosie preferred almost none of the literacy activities, kind of told me that she isn't really interested in engaging in that literacy work. She mostly liked being read to, or liked doing activities related to literacy that were more engaging with another person. So it's important to recognize this discrepancy, because if we're overestimating what a student can do, it really sets them up for failure. And if we're underestimating what a student can do, it can really decrease their motivation to learn. All right, so none of the participants' responses suggested that they considered themselves proficient readers and writers. Now, this doesn't mean that there aren't people with Rett syndrome out there that consider themselves readers or writers. This is just these 3 participants. For example, Cam said, I am not a good reader. Maven said, I still have trouble with this. talking about reading, and I don't like reading. And then thirdly, all the participants expressed a preference for having autonomy in reading and writing. They all wanted to be able to pick the book they were going to read or pick the topic that they were going to write about. So I feel like that was a really important finding to remind us that we need to provide those opportunities to make choices, selections, and really value autonomy when we're working with these individuals. Okay, so we've looked across the participants. Those are the two things that I found across the three. Let's look at each one of them a little bit more closely. So this is Rosie. Rosie's a 13-year-old girl. She actually turned 14 like the day after we finished data collection, who had been using a Tobii Dynavox with eye gaze since she was about 3. She was educated in a separate special school in a classroom with 5 other peers and 1 teacher. So here in the US, that is a educational setting. I'm not sure if that seems exactly the same for you in the Netherlands, but that means that the entire school is for students with significant disabilities. And so Rosie was reported to enjoy reading together, and during our session, first when we were establishing a rapport, she used her eyes to point to the book that she wanted to read with me. So this is Rosie's talking mat that she made about how she prefers to communicate with others. And you'll see she rated using her mouth, body language, paper symbols, and her AAC device as all highly preferred. Those are good ways. And then spelling, using her eyes, answering yes/no questions, her face, and using sign language, those were okay ways. And she rated nothing as not for me. So anything is fair game for Rosie. Nothing's off the table. She's really willing to try anything. The one that I think is interesting is sign language. She rated as being okay. When I asked her, Rosie, how do you feel about using sign language to communicate with others? She looked at me like she wasn't so sure. So I said, sign language is usually used by people who are hearing impaired, and they use their hands to communicate with others. And so that's when she told me, okay. And so I want you to keep that in mind as we watch a short clip of one of our interactions together. So what to look for in this short video. I want you to think about if you could recognize the different modes of communication that she uses. How does she express yes to me? And then pay attention to her hands, and we'll see if we can't figure out how she answered these talking mats questions.
What do you think about communicating using symbols on paper? Mom said they do this a lot, or sometimes in school. They have symbols on paper, yeah. What do you think about that for you? Yeah. You're looking at good. Using symbols is good for you on paper, yeah? Okay. So I'm gonna put it underneath good on our mat here. So now you have these 3 are ways that are good for you to communicate with others.
Okay, so I'm looking for a volunteer. What did you see? What are ways that Rosie used to communicate with me while we were doing this interview?
Dus er mag gereageerd worden. Het mag ook in de chat gezet worden als je even niet in de gelegenheid bent. Wat heb je gezien in de video hoe Rosie signalen geeft. Wachten even.
Do we have any volunteers, or should I give the answer?
Yeah, there is head movement.
Mm-hmm.
Mm-hmm.
Yes. Okay, so maybe you also noticed Rosie used eye contact, head movement, facial expressions, gestures, and she used her hands to directly select. So you can't see because her Toby's in the way, but she takes her hand and she smacks the talking mat where she wants her answer. So
yes. And
yeah.
so someone else also said, I thought that she was looking away, and maybe that she communicated no as an answer, like turning her face from you.
Yeah, she does look away and then she does look back. Right.
Yeah.
Two interesting things happened in this interaction. The first thing is I asked the talking mats question and then I asked a yes no question. I think I said, Mom said they use paper symbols at school, right? And so I'm looking for her to say yes or no. And she immediately goes and claps once. And while I was collecting the case history the day before, Rosie's mom said, when I asked her, how does your daughter communicate? How do you understand her? Her mom said, well, she listed a few things and she said, well, when she's with her dad says that she claps once for yes and twice for no, but I don't really think that that's meaningful. And Rosie was sitting right there when her mom said that. So here we are having our first interview, and I ask a yes no question, and she just comes out with a big old clap. One yes, one clap for yes. I took that and ran with it and I said, okay, I acknowledge that as meaningful. Yes. And so I said, yes, okay. And then we continued this interview. Also, over the course of these 3 days that I was with her, I continued to acknowledge and confirm when she clapped once for yes and twice for no, once I had asked a yes no question. And so that really is a way that the two of us not only built a rapport together, but we built this shared understanding that she was going to use different means of communication to get her point across, and that I was going to recognize that in her. And so that was very cool. So she does use her hands, she does use her head movement. Later towards the end of the video, she looked at good on the talking mat on the top scale. And then I asked her to confirm with me, and she looks up at me and looks and gives me eye contact to confirm. So that was pretty cool. Okay, this is Cam. She's a 9-year-old girl who's homeschooled with her twin brother by her mom. Cam was reported to love listening to music, watching Gabby's Dollhouse was her favorite show, being with friends and family. Her mom described her as very smart and eager to learn, and that Cam was learning to read, spell, do math, sorry about that, as well as music, history, and science. Okay, here is Cam's talking mat. And this is all about reading. You'll notice that Cam rated reading words and getting to choose the book as highly preferred. So she really liked that. And then she rated just okay as reading like picture books. So with a picture with a little bit of text underneath. And then everything else that I asked her about was all not preferred. She was a no girl this day. And she said that, a lot of these things related to reading, like reading long sentences, reading and asking questions, making predictions, talking about the book, these were all just rated as no. Those don't work for me. So this led me to ask many more follow-up questions to get a better understanding of how she saw herself as a reader. And what I learned about Cam from this interview and her ratings on the talking mats is she is just still developing her reading skills. This was not this was unique to Cam, not that the other two participants weren't also learning and developing, but Cam was particularly aware of still really wanting and needing to develop her reading abilities. And for example, she was quoted previously, I read to you, she said, "I'm not a good reader," but I followed up with that comment, and she said she wanted to be one. She wanted to continue working on her reading skills. Okay, and then this is Maven. Maven was also a 13-year-old girl, and she was in a fully inclusive general ed classroom. So she is going to school with other 7th graders and has a support person in her classroom. And so she'd also been using her Toby since she was about 3. She loves Taylor Swift and fashion and being with her friends. So Maven's preferences for communication were mostly embodied, right? So she came to me as a participant who was considered to be a very competent AAC user. People in her life, her teachers, her mom, other people that I know in the community that know her said she's a really good AAC user. But here, Maven is saying, you're asking me what my preferences are, and my preferences are that you read my body, you look at my eyes, you watch my facial expressions, and you ask me yes, no questions, and you interpret what I'm saying. And she did rate using her AAC device as just okay. So I'm going to show you a clip from our interactions together doing our, I believe this is our first interview. And I had just asked Maven, what do you think about using your face to talk to others, like smiling or frowning and making silly faces? And I'm working to try to figure out her response. And so what I want you to look for in this video, what are the modes of communication she used? How did she respond to talking mats? What does she do after responding? Or just what did you notice? So I'll play the video, and then if you feel like writing a comment in the chat about what you saw, that would be cool.
Okay. No. I see you mostly looking at okay. Thanks for confirming by looking at me. Thank you. I appreciate that. I want to get it right. I want to make sure I know what you're thinking. All right, here's another one. What do you think about using
navigate? No way.
No way.
Thank you.
Thank you. You're welcome. I want to get it right. It's important to me. I appreciate your thought.
Okay, what did you notice, or what are your thoughts?
All right, so I think she used her voice in the very beginning. En als er nog andere reactie hebben, typ het gerust nog in de chat. So these are my responses.
Okay.
But also if there's others who want to respond, that's totally fine. And she used her computer, I think, for a couple of phrases, maybe some preset phrases, like no way is probably like a one, it's not just a simple one word. Right. And then I think she also used eye contact with you. Mm-hmm. I think those are the 3 that at least so quickly I've recognized.
Yeah, thanks. Yes, I agree. So she does use her voice in the beginning. She kind of does this thing. She does that kind of often when she, I'm not exactly sure 100% of her intention, but you're right. She does use her voice. She did use eye contact to confirm with me. She used her eyes to point to where she wanted that option about using her face on the talking mat. And then she did give me eye contact for confirmation. The cool thing that I think happens in this interaction is she redirects the conversation, and instead of us just moving on to the next question, she goes, no way, stop, navigate. And so she's you can't see it on her Toby because I don't have the other view pulled up here, but she's moving from the current page that she was on onto another one. I think it's a social page. And she says, thank you, after I say, I want to get it right. It's important for me to know. She says, thank you. And then she looks back at me, and that's to signal that's the end of her message. So this suggested to me she is very skilled at using her device, like the people around her said that she was. She knows how to interject into a conversation. She knows how to expand on the interview topic outside of our structured questions. And she understands the importance of a communication partner who is willing to take the time to get it right and acknowledge that she had valuable and worthy things of sharing. So to me, this is just so powerful. This is not the first time that Maven stopped to thank me during different points in our interviews. It happened several other times where she and I continued to have this conversation of mutual appreciation for one another. I expressed to her how valuable I think her thoughts are and how hard I'm going to work to make sure I understand her. And she expresses to me, thank you. Thank you for doing this. Thank you. There's another quote that she says in the second interview. She says, something to the fact of like, you're helping me get better with this. And so it was this really cool shared mutual appreciation for one another that I was not expecting to come out of this work, but was very cool. Okay, so all of these findings pointed to this very salient theme of resilience. So resilience to me is a concept that is defined by 1, the presence of adversity, and 2, adaptability. So a lot of people may take this individualist approach to resilience, that there's something within that person, like there's grit, or they can bootstrap, and that's why they're resilient. But others take this much more ecological perspective, that there is adversity and risk around the person, and that there are supportive factors that enable them to adapt to adversity and allowing them to be resilient. And this is kind of where I think we camp out with people with Rett syndrome. So they have internal and external factors that make communication really challenging, right? But I would argue that the 3 participants in my study had these internal and external factors. But despite the adversity that they faced, they all demonstrated adaptability. So like in the first theme, they adapted their communication to the communication partner. They had these individual differences that were related to having Rett syndrome that showed how they were adaptable, like how Rosie used her hand clapping with certain communication partners, and Cam used her voice with certain communication partners, and Maven had this shared mutual appreciation that she expressed with us. And so all of these were just these multiple indicators of resilience across all 3 of the participants. Okay, and then one other thing that I think came out of this work that is super interesting, if you remember back to the beginning of this presentation, and I told you about these 2 terms that Doak offers to us, systematic and idiosyncratic communicators. So Rosie, Cam, and Maven were both. They were all both. They all could be systematic. Whoops. They all could be systematic, but they all could be idiosyncratic. And they floated in between these 2 categories, depending on like the moment or who they were talking to or what their body was doing. But what's super interesting is I think that beyond these 2 categories, the participants demonstrated that they were not just either or, systematic or idiosyncratic, but that they were strategic. They knew when, decided when, and with whom to use either or both modes. So Maven was strategic in the way she decided how to communicate with her sisters, and the example of Rosie clapping with me. And Cam did this thing where she would wrinkle her nose like this to let her mom know that she had to use the bathroom as soon as her mom, would walk over. And so there's this level of strategy that the participants are doing, where they're not just either or systematic or idiosyncratic, but it's that they selectively choose when and with whom to use their communication. So the implications of this work is obviously extending the research on the communication profile of people with Rett syndrome. Like I said, this is the first time they've been interviewed directly. I think that this work can inform our clinical practice. So it tells us things like considering embodied AAC, not only aided AAC. I think it's really important to recognize that people with Rett syndrome deserve greater opportunities to learn symbolic communication and reading and writing. And then lastly, assuming potential is really important, but we must continue to teach and build skills and self-efficacy. Like in Maven's case, currently she's in 7th grade and nobody's teaching her to read and write because everyone assumes that she already is. And yet she's saying, wait, I'm not so good at this. I need to continue developing these skills. So we can't let our presumptions of competence and potential get in the way of providing good instruction. And so in the future, I think I will continue to work on more inclusive research, meaning including people with Rett syndrome, maybe in creating the talking mats, like what are some topics that you want to talk about? What are some of the option cards that you want in there? It was really cool to have them participate in the member checking. So when I met with each of them at the end, after I'd analyzed all of the data, and I went back and said, this is how I see you as presenting yourselves. You are resilient, you are adaptable, and you still see work to be done in your reading and writing. All of them had different ways that they told me, yes, 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 me. Really like positive feedback using their devices and their body to tell me that. And so that was really cool. I think that that's an opportunity to, again, be more inclusive in our research, to go back to the participants and say, hey, this is what I found. What do you think? And then future work, I think, would be fun to explore the discrepancies between people who work with Rett syndrome, their caregivers, and their professionals who work with them to get a better range of perception. Also, something that came out in this study was that they all had different educational settings. I think it would be interesting to look at how the educational setting might impact their views of themselves as readers and writers, thinking about opportunities to learn and how that looks different in different educational settings. That is the end of my talk. I really thank you for listening, and I welcome any questions you might have, or comments or feedback. And if you want to know more about the work that I was engaged with at the Center for Literacy and Disability Studies, that is a QR code that will take you right to our lab.
Wonderful. Very, very informing presentation. Thank you so much. Als er vragen zijn of opmerkingen, dan lees ik ze graag in de chat. Ik heb zelf in ieder geval ook een aantal vragen, dus daar zal ik alvast mee beginnen. Als jullie nog meer hebben, dan... Oh, wacht, er komt een vraag. There is a question.
Okay.
How do you... Wait, let me read it first in full in Dutch, and then I'll just do it first in Dutch as well for the recording, because people probably will not see it. Yeah. Hoe kijk je naar de groep met Rett-syndroom en wat zij nodig hebben aan onderwijs ten opzichte van andere syndromen, waar ook ernstige beperkingen zijn? Is er een speciale groep ten opzichte van andere syndromen? Is het iets vergelijkbaars? Okay, so what is your view on individuals with Rett syndrome when it comes to education? Do they, is it a group on its own, or could they actually be similar to other groups with severe symptoms or severe conditions in taking part in education and how they view themselves?
Well, I've always said, and the other members of the communication guidelines research team has always said, that what we learn about people with Rett syndrome can be applied to lots of other very similar communication profiles. So I don't think that Rett syndrome makes you unique in that you deserve really quality instruction on how to do reading and writing and opportunities to learn to be a autonomous symbolic communicator. So I think that just acknowledging that there are some differences in like those internal factors that Rett syndrome creates, like apraxia, moments like the Rett episodes, or things that like they don't sleep that well and they might show up to school or your session having had a terrible night's sleep, right? Those are things to know exist within Rett syndrome, but also can occur across the board. If Harna and I show up for a meeting together and she's just like, I slept terribly, please don't expect too much from me today. I have to take that into consideration, right? Just being a kind human being. And so I think when we acknowledge those differences of what Rett syndrome does internally for our clients and our students, that's one thing. But the overarching idea to me is that people with complex communication needs and multiple comorbidities and significant support needs, regardless of their diagnosis, deserve quality instruction to learn how to read, write, and communicate.
Ja, dus ze zegt eigenlijk iedereen heeft recht op die onderwijs, toegang. En zoals ook wel eerder met de richtlijn communicatie zijn er veel lessen die als eerste geleerd worden, of in ieder geval die op deze manier naar buiten komen binnen Rett syndroom en waar een goede organisatie achter zit om dat ook gezamenlijk te onderzoeken. Dat is een stukje wat ik er zelf ook even aan toevoeg, maar dat het daardoor hiervoor beschreven staat en misschien nog wat minder voor sommige andere groepen, maar dat het ook daar zeker van toepassing is. Well, it's interesting what you mentioned the dyspraxia, because that was something that that I wanted to ask you about. What's your take on the influence on the dyspraxia or apraxia in choosing or be like with that balancing from idiosyncratic to symbolic communicator or systematic communicator? And was it always was their preference? So that's the second question. Was their preference based on the individual that they're communicating with? So based on, okay, you will understand this, or could it also be because, and I don't know if you got to talk about this, is it because in one moment they are able to do certain things and another moment they're not because of the dyspraxia?
Mm-hmm. I think both of them play a factor. I think that they are strategic and that they're making these decisions in real time of my body is not allowing me to turn my head and access my eye gaze device and select, one or two or three icons to, string together a sentence. And so I am going to resort to this way that I know I will be understood, which is my body, or which is eye pointing, or which is my voice. I think that I don't know that for sure because I did not explicitly ask, does apraxia make you do this, right? I did ask more introspective questions, such as, when you're talking with your sisters, your older sisters, why do you choose to have them read your body? Or why do you choose to have them answer yes, no questions? And the participant, Maven in particular, shared things like, using my Toby is lonely. Lonely.
Using my Toby is lonely.
Is lonely. Answering yes, no questions is not annoying, because I said something like, well, when, I say, do you want this or this? Do you want that or that? Over and over again, doesn't that get kind of annoying? That was my perception. And she was like, no, that's fine. Because that's a way to clearly indicate this is what I want. So there was some conversation about that. I think it's definitely an area that I would have liked to probe a little bit more. And the last thing that you said made me think of, and I didn't say this, but at the end of an interview with the talking mat, you review the entire thing with the person, and you say, is there anything you'd like to change, or is there anything, any of these options that I misunderstood or you're having a different feeling about? And so I feel like that format allows for, if they were misunderstood, or if they communicated in a way that was wrong, they could change it. So that's why I think it was a nice framework to use for this sort of activity.
Yeah, wonderful. And I think there's still a lot more questions that, can be asked in the future. So that yeah, this is really good. So I know that in the Netherlands, I think starting in September, or maybe it might be August, but anyway, our comparison to the IEP will become, so actually all the children will get the right to read their own IEP. So at the moment, that's not yet common practice. Dus op dit moment is het nog niet zo dat je in Nederland de kinderen ook het recht hebben om hun OPP in te zien, dus hun persoonlijk ontwikkelingsplan. Dat gaat wel veranderen, dus dat is ook een goed thema om nog eens verder naar te kijken, hoe we ze daarin kunnen ondersteunen. What do you feel like your insights on how you can have these conversations could how can you see this benefiting towards, them actually influencing their own IEP goals, especially with, the discrepancies that you've found within some of these individuals already. And of course, it's a very small group. It's multiple case studies. So it's not like you've asked 10 or 12 or even like 20 individuals yet, but
yeah, it's so interesting because there is a paper out from like 2011 that general education, within the general education, they use talking mats to help students be more involved in the IEP process. And in doing that, they really took a broad topic, which is learning how to read, and then they did little like splinter skills. So like letter ID, rhyming, syllables, punctuation, right? We took all the little skills that go into learning how to read, and they did a talking mat about, how do you see yourself in this area of reading? How do you see yourself in that area? And the researcher demonstrated how the talking mats were really helpful in helping kids identify areas of weaknesses and areas of strength to help inform choices and goals for their IEP. And so I thought, why can't we do this for this population too? We could say, now we have the data from 3 people who say, I'm not a good reader and writer, but I want to be. And now let's break those 2 things down. Let's break it down into even smaller groups and say, either like preferred activities to work around those, or like smaller skills. And I think the talking mats is a great way to go about that. And it gives them a voice within the IEP meeting, right? Like sometimes the meetings move very fast and we don't have time adults don't take the time to stop and wait for a message to be constructed. Well, what about if the talking mats was kind of going on the sidelines, or it occurred beforehand, and then the talking mats was brought into the meeting to share, to say, these are her preferences around this thing that you're meeting about, and here's her voice and what she'd like to contribute.
Yeah. So I think that there's definitely something that we could take a lead in as speech pathologists, as we have this skill of using these talking mats to actually do a conversation prior to a meeting about the goals that we're going to be working on, or that we would, as adults or as professionals, set for them or choose and pick for them, to actually let their voice be heard in that sense as well, and to at least have the consideration, like, hey, did we ask them what they would want? Then of course the whole reading continuum, there's so many different skills to really break it up, like, okay, what do you want to be better in, or which skill would you like to improve? How would you like to do that? So there's another question and also response. She said it's an eye-opener to actually take the considerations of an individual with Rett syndrome as a topic of research. So that's new. And she's explaining that she's currently helping an individual filling up her TOBI, so the vocabulary, I guess. And then she said, so will it continue to be important to practice all these different ways of communication, so all these different modes of communication?
Mhm. I think it's good to ask the person that you're working with how they prefer to communicate with others. There's a time and a place for all of those modes, just like we have a time and a place for texting versus phone chat versus, right, like talking face to face. I think it's really nice to consider maybe doing a talking mat based with different modes of communication, and ask the person that you're working with, like, hey, how do you like interacting with me? How is this working for you? And giving those choices. I did eyes, facial expressions, paper, spelling. And there could be more. You could think of more. But I think it's nice to ask, how do you prefer to do this? There's a very robust or increasingly robust field, aspect of our field that's looking at embodied communication. And what we're finding is that when there's a speech generating device involved, we tend to only pay attention to the device and not pay attention to the person's body. And when we hear from people who are very skilled AAC users, they say, we don't really like that. We don't really like when you ignore our bodies and you just look at our devices and you say things that, like, I saw you smile with your face, now show me on your device. We have adults who use AAC telling us that that really bothers them. And so I think that we need to pay a lot more attention to embodied communication and not just focus on the device. Although that does not mean that we need to stop using the device to model, teach symbolic language, because that is the only way that we will ever allow the people or create opportunities for the people that we work with to be able to say whatever they want, whenever they want, to whoever they want.
Yeah. And there probably also is still the topic of when, like, what do we push for? Like certain, like especially when you have, I know that certain individuals, when they, not necessarily with Rett syndrome yet, but in them being able to learn to construct a grammatically correct sentence, that actually helps for them as well to advocate for themselves. And for more people to understand, like, oh, you're actually really smart. Like, your broken up word sentence is functional, but you can also choose to then, in one situation, 2 words will be enough. Just like between 2 friends that really know each other well, it's like just a glance or a word and something is enough. Where there is another situation where it's actually preferred, or you would prefer to speak in a full sentence and to actually present yourself as a skillful communicator to a different level. To also be able to push that and to continue to set the bar for what we're going for. So yeah, I think all in all, very insightful research. And I'm already thinking we should actually come up with some sort of small publication or maybe an article for our Judge magazine for parents to really put this topic in there as well. So I'll talk with you about that after the end of this recording. But thank you for today. Thank you for your time. And yeah, I hope to hear from future research from you as well. Is there any public publications yet? Any articles that are being published?
No, I'm working on the manuscript. I'm hoping to get it written. I did drop my email address in the bottom in the chat, in case anybody has further ideas or comments that they want to say. And when I do have a publication, I'm happy to share it with you and
Yes.
Translate it. I'll leave that up to you.
No, that would be wonderful. Thank you very much. Thank you very much. All right, so we'll stop the recording.